Hello guys, welcome back to my channel. I decided that I'm going to talk today in detail about the basics of getting pregnant. Everyone knows what they need to do, right? Not really. They come to me after a few months of marriage, and mind you, just a few months of marriage, and they are worried that they're not getting pregnant. Whenever I ask them, do you know anything about your menstrual cycle, your fertile period? Are you doing it right? I often get very bewildered because they don't know. They are searching Google about everything, but they don't search about their normal cycle, their fertile period, and the basics of getting pregnant without any help. So, first things first. Normal cycle, when we talk about a normal cycle, it's a 28-day cycle. But it can be 26, it can be 30-day cycle, and that means that the time of fertility can vary by a day or two, right? So when is the fertile period? It is the 10 days after the periods. You should be together every alternate day. The gap shouldn't be longer, and I'll explain the reason for that. But these 10 days are significant. Often the ovulation or the egg comes out in the middle of these 10 days, but sometimes it's earlier, sometimes it's later. If you want to understand why the gap should not be more than alternate days, then you have to understand the egg comes once a month and it's there just for about 24 hours. The sperms live for maybe 2 days, 3 days, maximum 5 days. So if you're together in those 10 days after the periods, every other day, you're very likely to get pregnant because you'll be able to catch the ovulation. So that's the basic fertile period in a regular 28-day, 30-day cycle. So what's the next step? If you're not getting pregnant and you're together in these days, then see about how you're doing it. If you have questions, if you have concerns that maybe you're not doing something right, then the best thing is to go to a gynecologist, and the guy can go to a urologist even, and discuss their life together, their intimacy, and make sure that things are all right. Sometimes people think they're doing it right, but they may be having issues at the time. Then comes the next step. 3 months, 6 months, you're together at the right time, you really are doing it right and still not getting pregnant, then maybe it's time to go for a checkup. It's not a detailed checkup. It's a checkup that tells you everything is fine, or maybe there's a little problem. Often we tell patients that you should come for your first checkup after a year of trying regularly during the fertile period, where you know you're doing it right. Sometimes in some patients, it is suggested that they should come earlier, especially if the couple is older, especially if the lady is over, say, 35 or the gentleman is maybe over 40. It's a good idea to come sooner rather than later, and there are reasons for that, which I can explain to you another time. But coming back to what you can do when you're not getting pregnant, you've been trying for 3 months or 6 months, there's something called an ovulation kit. An ovulation kit. It tests the urine, the way you do the pregnancy test, right? It tests the urine and it tells you when your LH, one particular hormone that triggers the egg for release, when it reaches a certain level, the test comes positive, and you know that you're going to be ovulating 24 to 36 hours after that, right? And that kind of gives you a specific window to be together. There is, the calendars show the fertile period, which is very vague. You can take help from that. There is a change in the cervical mucus. Some people are very aware of that and are able to actually tell when they are going to be ovulating or are ovulating. So these are the things you can research and do for yourself. And this is the time when you should start noting your regular cycle, right? If it is, you're noting the dates, and then you get an idea of whether you have a 28-day cycle or a 30-day cycle, and you make sure that you're together at the right time. So the most important thing is doing it right and being together at the right time. Next step that you can do yourself is the ovulation kit. Okay, you've been trying it for 3 months, you still are not getting pregnant, then maybe the next step has to be the doctor. What we do at this stage is some basic test. When we ask the questions, the history, we get an idea of what could be wrong. Often when it's just a regular cycle and there's no significant point in the history, like family history of infertility or maybe some disease or some other thing that gives us alerts and alarms, it's just a matter of time. It's just giving it more time. People who don't get pregnant in the first year, even if we do nothing, 80% of them will get pregnant in the next couple of years. So actually very few people need our help. But due to their own pressures and the societal pressures, they often come to us for help, and we can't say no because that's usually unacceptable for them. So we start by the basic tests after taking the history, of course, and then we know the hormones are okay and the semen analysis is fine, and we can then track one cycle, see if the lady is ovulating naturally or not. After that, if we are sure that she's ovulating, we give them another 3 months. All right, try on those days, or maybe come to us for tracking every month. Let us see what's happening in every cycle. Are you missing ovulation in some cycles? Maybe some cycles you are producing an egg and some cycles you're not. There is a test for the tubes that connect the ovary to the uterus, that transport the egg to the uterus after fertilization. Sometimes there's a problem there. There may not be previous surgery, there may not be any known infection, and yet one or both of them may be blocked. The test is uncomfortable, so we are reluctant to do it at the first series, but often if the couple is older or they have been trying again after our initial consultation, then we do advise this test, and once we know the tubes are fine, we then take it to the next step. One thing you have to understand, medical science has its limitations. We only know so much, and then we don't know. We can see the egg is forming, we can see that you are ovulating, but we can't tell for sure if you're going to get pregnant. In every cycle, there's just a 20% chance of getting pregnant. 20%. So you have to be trying for at least a few months before you start getting worried. Coming to us in the second cycle, increasing your stress levels certainly decreases fertility. You've seen that happen. I've seen that happen. People are frantic about getting pregnant, and then they've tried so many different things and they're extremely stressed, extreme pressures on them, and then they adopt a child. Next month or the month after that, they get pregnant. Just like that. That's because stress and all the pressures definitely reduce fertility. The body is a whole. It's not just your ovaries producing an egg. It's not just the uterus receiving the embryo. Your body is a whole, and everything that is happening is connected. And now we have seen that stress is an important factor. Why am I mentioning it here? Because please relax, just give it time. Do consult us when you're concerned, but then listen to us when we tell you that there's nothing wrong. Because when you ask us, if nothing is wrong, why are we not getting pregnant? Our answer is, you just need time. Maybe there are factors that science is not aware of yet, but amongst the known factors, we look through everything, and then things have to be left to work out on their own. Yes, we have help to offer in certain conditions, and if nothing works and nothing is found wrong, even then we start medication just to help things along and offer other processes. So just understanding your cycle is your first step. Understanding your fertile period is your second step. Maybe using an ovulation kit is your third step. And going to your doctor should come after that at 1 year for those who are young, and maybe sooner for those who are older. I hope I'm able to help you here now and in the future. Thank you.